After the age of 60, tingling hands and weak legs become so common that many people start treating them like background noise, something annoying but normal, something to be tolerated rather than questioned. You wake up and your fingers feel numb, or you sit for a few minutes and your legs hesitate before standing, and everyone around you tells you it's just age catching up. That belief quietly steals your confidence and lowers your expectations, making you assume this is simply how life is supposed to feel now. But the truth is, common does not mean harmless, and frequent does not mean inevitable. Tingling sensations are often a signal from your nerves that they are under stress, undernourished, or losing protection, while weakness in the legs usually points to deeper changes in muscle support, joint cushioning and circulation. When these signs are ignored for years, they can slowly turn into balance problems, fear of walking, reduced independence, and even higher risk of falls. What makes this especially important is that many seniors delay action because the symptoms come and go. One day your hands feel fine, the next day they buzz again, and that inconsistency makes the problem easier to dismiss. Weak legs often creep in the same way, first noticeable on stairs, then during longer walks, until one day even standing from a chair feels like effort. These are not random inconveniences. They are messages from your body asking for attention. Not panic, not fear, but awareness. Aging does change the body, but it also changes its margin for error. Small deficiencies or imbalances that once caused no trouble now show up loudly through nerves and muscles. Another reason these symptoms get overlooked is because they are rarely painful at first. Tingling feels odd rather than severe, and weakness feels like fatigue rather than injury. Pain tends to demand action, but quiet symptoms often slip through. Yet these early signals are actually your best opportunity to intervene, because the body is still highly responsive at this stage. Supporting nerves, circulation, and connective tissues early can slow progression and sometimes even reverse discomfort. Ignoring them, on the other hand, allows gradual decline to harden into limitation. There is also an emotional side to this that few talk about. Tingling hands can make you feel clumsy and frustrated when buttoning clothes or holding objects. Weak legs can make you cautious, hesitant, and less willing to move, shrinking your world a little more each month. Movement decreases, circulation worsens, muscles weaken further, and a quiet loop begins. Recognizing these symptoms as meaningful rather than meaningless breaks that loop. It shifts your mindset from helplessness to participation. Instead of saying, "This is just age," you begin saying, "This is information." Understanding that tingling hands and weak legs are signals, not sentences, opens the door to simple daily choices that support strength and stability. When you stop ignoring what your body is whispering, you give yourself a chance to stay active, independent, and confident for years longer than you might expect. One of the most overlooked reasons aging symptoms worsen so noticeably after 60 is the quiet loss of collagen inside the body. Most people associate collagen with skin, wrinkles, or cosmetics, but collagen is far more than a beauty protein. It is the internal framework that holds muscles together, cushions joints, stabilizes tendons, and protects delicate nerve pathways. When collagen levels are strong, movement feels smoother and nerves remain insulated and calm. When collagen declines, everything from grip strength to balance begins to feel less reliable. This decline does not happen suddenly. It starts slowly, often after the age of 40, and accelerates as the years go by, making its effects more visible by the time most people reach their 60s. As collagen decreases, the spaces between tissues change. Joints lose cushioning, muscles lose elasticity, and nerves lose some of the protective layers that help regulate sensations. This is one reason tingling hands and weak legs often appear around the same time. Without adequate collagen support, small stresses that the body once handled easily now irritate nerves or strain muscles. Everyday actions like walking, climbing stairs, or holding objects begin to feel more demanding. Not because the body has suddenly aged overnight, but because its internal support system has thinned out quietly over years. Another important factor is that collagen also plays a role in circulation and tissue repair. Blood vessels rely on collagen to stay flexible and resilient. When collagen weakens, circulation can become less efficient, reducing the flow of oxygen and nutrients to nerves and muscles. This reduced nourishment can intensify sensations like numbness, pins and needles, or heaviness in the legs. Over time, muscles that are less well supplied begin to weaken, reinforcing the cycle of reduced movement and further collagen loss. What makes collagen loss particularly tricky is that many people unknowingly speed it up through diet and lifestyle choices without realizing it. Low intake of vitamin C, chronic inflammation, high sugar consumption, poor sleep, and reduced activity all signal the body to break down collagen faster than it can rebuild it. Aging alone is not the full story. The body is constantly responding to signals, and when the signals lean towards stress rather than repair, collagen breakdown wins. This is why two people of the same age can feel completely different in terms of strength and mobility. The encouraging reality is that collagen decline is not a locked door. While production slows with age, the body retains the ability to produce and protect collagen when given proper nutritional and metabolic support. Recognizing collagen loss as a root cause rather than an unavoidable fate changes how you approach aging symptoms. Instead of chasing individual problems like tingling hands or weak legs separately, you begin supporting the underlying structure that affects them all. By addressing collagen health, you are not just easing symptoms, but strengthening the foundation that allows your body to move, feel, and function with greater confidence as the years continue. Collagen plays a central role in keeping the body stable and responsive, especially as the years move past 60. Yet most people never realize how deeply this one protein influences daily comfort and movement. Collagen acts like a flexible framework that gives shape and strength to muscles, joints, tendons, ligaments, and even the protective coverings around nerves. When this framework is strong, movements feel coordinated, hands feel steady, and legs respond when you ask them to move. As collagen declines, that same framework begins to soften and loosen, creating small gaps in support that the body feels as weakness, stiffness, or unusual sensations. In muscles, collagen works alongside muscle fibers to help transmit force efficiently. It allows muscles to contract and relax smoothly without strain. When collagen levels drop, muscles can still contract, but the transmission of strength becomes less efficient. This is why legs may feel weak even when muscle size has not changed dramatically. The muscles are working, but the connective tissue support that stabilizes and amplifies their power is no longer at its best. Over time, this leads to quicker fatigue, slower recovery, and reduced confidence in movement. In joints, collagen forms cartilage and other cushioning structures that reduce friction and absorb impact. Healthy collagen allows joints to glide rather than grind. As collagen weakens, joints lose this smoothness, leading to stiffness and discomfort that can discourage movement. Reduced movement then feeds back into further collagen loss, creating a cycle that affects both strength and flexibility. This stiffness often appears in the knees, hips, and ankles, directly influencing how stable your legs feel during walking or standing. Perhaps less obvious but equally important is collagen's role in nerve protection. Nerves are surrounded by connective tissue layers that rely on collagen to stay intact. These layers act as insulation, helping nerves transmit signals clearly without excessive stimulation. When collagen thins, nerves become more sensitive to pressure, blood sugar fluctuations, and inflammation, which can manifest as tingling, numbness, or burning sensations in the hands and feet. This is not always a nerve damage issue in the classic sense, but often a support issue. Where the nerve environment has become less protective, collagen also influences tendons and ligaments, which connect muscles to bones and stabilize joints. Strong collagen keeps these structures firm yet flexible, allowing for controlled movement. Weak collagen makes them more prone to strain, contributing to instability in a sense that the body is not responding the way it used to. Understanding collagen as a unifying force rather than a cosmetic concern reshapes how we view aging. Supporting collagen means supporting the systems that allow you to grip, walk, balance, and move with assurance, turning attention away from isolated symptoms and toward whole body strength and coordination. After the age of 40, the body begins a gradual but steady shift in the way it maintains itself, and one of the most significant changes is the slow reduction in natural collagen production. This process happens quietly, without pain or warning, which is why most people do not notice it until its effects begin to interfere with daily life. Cells called fibroblasts are responsible for producing collagen, and as the years progress, these cells become less active and more selective. The body still produces collagen, but not at the same speed or volume as before, meaning breakdown starts to outpace repair. By the time someone reaches their 60s, this yearly decline has accumulated into a noticeable difference in tissue strength and resilience. What once felt like flexibility begins to feel like stiffness, and what once felt like strength begins to feel like effort. Muscles rely on collagen to anchor fibers together, joints depend on it for cushioning, and nerves need it for insulation. When collagen supply drops year after year, all these systems begin to experience small compromises that add up over time. It is not a sudden failure, but a gradual thinning of support that makes the body more sensitive to stress. Hormonal changes play a role in accelerating this decline, especially after midlife. Shifts in estrogen, testosterone, and growth hormone levels reduce the signals that tell the body to build and repair connective tissue. At the same time, blood flow to the skin, muscles, and joints becomes less efficient, further limiting the delivery of nutrients required for collagen synthesis. Even if diet remains unchanged, the body's ability to use those nutrients effectively diminishes, creating a hidden gap between intake and actual tissue repair. Lifestyle factors also influence how rapidly collagen production slows. Chronic stress raises cortisol levels, which interfere with collagen formation. Lack of movement reduces mechanical signals that normally stimulate fibroblasts to produce more collagen. High sugar intake increases glycation, a process that stiffens existing collagen fibers and makes them more prone to breakdown. Over the years, these factors compound the natural age-related decline, making collagen loss more pronounced than aging alone would cause. Understanding that collagen production declines progressively after 40 reframes how we approach aging. Symptoms that appear in the 60s are often the result of changes that started decades earlier. This perspective empowers you to act rather than accept discomfort as unavoidable. While time cannot be reversed, the body's biology can be supported. Fibroblasts may slow down, but they do not stop working altogether. With the right nutritional signals, reduced inflammation, and consistent movement, collagen production can be encouraged to function more efficiently than it otherwise would. Recognizing this decline early turns aging into a process that can be guided rather than endured. When collagen levels drop, the effects are rarely confined to one area of the body, because collagen is woven into nearly every structure that keeps movement and sensation smooth. One of the most noticeable consequences is increased nerve sensitivity. Nerves rely on surrounding connective tissue for protection and stability, and when that support weakens, nerves become more reactive to pressure, inflammation, and changes in blood flow. This heightened sensitivity can show up as tingling, numbness, or a prickling sensation in the hands and feet, especially during rest or at night when circulation naturally slows. These sensations are not always signs of severe nerve damage, but often signals that the environment around the nerves has become less supportive. At the same time, reduced collagen affects muscle strength in subtle but meaningful ways. Muscles do not operate in isolation. They depend on collagen-rich connective tissue to transmit force efficiently and to maintain alignment during movement. When this connective tissue thins or stiffens, muscles must work harder to achieve the same result. This inefficiency contributes to the feeling of weakness, particularly in the legs where muscles bear body weight and manage balance. Tasks that once felt automatic, like standing up from a chair or climbing stairs, begin to require conscious effort. Joint stability is also compromised by collagen loss, which further contributes to muscle weakness. Collagen forms the backbone of cartilage, tendons, and ligaments, all of which stabilize joints during movement. As these structures weaken, joints may feel less secure, causing the body to limit motion as a protective response. Muscles then receive less stimulation, leading to further weakening over time. This protective restriction, while useful in the short term, can accelerate decline when it becomes habitual. The combined effect of nerve sensitivity and muscle weakness often reinforces itself through reduced activity. Tingling can discourage movement, while weak legs increase fear of falling. Less movement leads to poorer circulation and reduced stimulation of collagen-producing cells, deepening the original problem. What begins as a biochemical change gradually becomes a functional one, impacting confidence, independence, and quality of life. It is important to understand that these changes do not mean the body is failing beyond repair. They indicate a shift in balance between breakdown and rebuilding. Collagen loss tilts the scale toward fragility, but that balance can still be influenced. Supporting collagen health helps restore a protective environment for nerves, improves force transmission in muscles, and stabilizes joints. When the underlying support system is strengthened, sensations calm and movement becomes more reliable. Recognizing this connection transforms tingling and weakness from mysterious symptoms into understandable signals, offering a clearer path toward maintaining strength and comfort in later years.